how do you determine which reconstructive technique is best for you?
That's a great question. There are several factors that would determine that. If the patient is having one breast done and we're just trying to match it to their other natural breast, in general, patients like that do better if we build them a breast with their own tissue because it tends to mimic a natural breast better. If a patient is very thin, they may not be a candidate to build a larger breast with their own tissue because the sites where we would bring the tissue from would be smaller because they have less fat underneath their skin. And it also depends on if the patient is having radiation. Radiation complicates implant reconstruction. It doesn't mean that you can't have it, it just means that chances that the implant sits a bit higher, feels a bit firmer, shape has a bit of a change after radiation. All of those things can change after radiation. So although implant reconstruction can be done with radiation, it's not as straightforward. So it depends on whether you're doing one breast or both breasts, the patient's body size, how much surgery they're willing to undergo, of course, and how much recovery they're able to take off work, how much support they can have to help them in the post-operative period. Lots of factors play a role. So typically what I do when I meet the patient, we go through and of course I should mention their medical and surgical history, because patients who have lots of medical comorbidities are not as good candidates to have a really long operation. So in general, with those patients, you'd probably be thinking of implants. So typically when I meet a patient, we review their medical surgical history, details about their breast cancer, when the treatment is being planned for, if they're having chemotherapy, radiation. I of course ask them if they have any preferences ahead of time from what they've read about or heard from friends who've had breast cancer as well. And then I examine them, and that gives me an idea about what their options are. And then typically we review what each options are, the pros and the cons. And I find a lot of the time, just in speaking to the patient and getting a sense of what their goals are, we're able to come to a decision pretty easily most of the time.